Do you remember in your experience any complex surgery or you felt like it's too tough, but you came out with beautiful results?
We do challenging
Yeah,
cases
most of the
almost
time.
every day.
Yeah.
We map the disease. Our challenges are overcome when the patient gets back to her previous life.
Mm-hmm.
We have patients who have lost their job because of the pain they could not do, and after the surgery, they have joined their jobs back.
Mm.
We have patients where they could not conceive, they come back with their babies in their hand after the surgery. These are the rewards we get.
Okay.
So, very complex cases, if I talk about, there is a patient where she had a sciatic nerve endometriosis.
Mm-hmm.
A patient used to limp every 15 days in a month.
Mm.
Very painful limping movement. She cannot walk for
Mm.
those 15 days. She went to neurologist, she went to neurophysician, pain specialist, several gynecologists, orthopedician, and everyone, and nobody could diagnose her.
Mm.
And then we diagnosed her, and this was a very unusual case. It is third case in the world.
Okay.
So, sciatic nerve endometriosis is not very common but seen. But this was an extra pelvic sciatic nerve. This was outside the pelvis. So
Mm-hmm.
we identified and we had to involve a neurologist, a neurosurgeon, and an orthopedician to solve that case. And this was not done through the abdomen. We
Mm-hmm.
had to do it from the gluteal region.
Mm.
And there was a 4 centimeter mass which was compressing on the sciatic nerve, and that was endometriotic tissue.
Mm-hmm.
We excised it, and patient are 2 years down the line is doing fantastic. She can walk nicely and she's doing well, and all her symptoms are gone. These patients, if we don't treat, they will have permanent nerve damage. They will have foot drop because the sciatic nerve is the main nerve which
Helps in.
helps in the walking and motor symptoms. So they will have a gross motor symptoms, and once the nerve is damaged, we cannot reverse it.
Yeah.
So this was a fantastic case which we did, and there
Mm-hmm.
are several other examples which we have
Mm-hmm.
been doing. One more thing I would like to mention is silent kidney loss is very common in endometriosis.
Okay.
Now, what happens is, as I said, 50 to 60% patients have pain, but there are is a 40% patients where they don't have any symptoms at all, but they may have endometriosis.
Okay.
So this endometriosis grows laterally and tries to engulf the ureter. Ureter is a pipe which connects the kidney to the bladder,
Yeah.
and it starts dilating.
Mm-hmm.
In turn, the kidney starts dilating because patient does not have any symptoms. He does not go to the doctor, and it is neglected. Or
Mm-hmm.
sometimes what happens is, even if they diagnose that dilatation of the ureter,
Mm.
they go to the urologist and they do not go to the endometriosis doctor because they didn't know,
Yeah.
it was not diagnosed.
Mm-hmm.
In those cases, they might lose their kidney, and this is real. Silent kidney loss is real. That is why endometriosis, if you are diagnosed with endometriosis, even if you don't have symptoms,
Mm.
even if you don't want pregnancy, go to a specialist, get the evaluation done. If it is not damaging any organ like ureter or kidney or bowels, in that case we can keep you under interval growth monitoring.
Okay.
We need not start any treatment or do a
Mm-hmm.
unnecessary invasive surgery,
Mm-hmm.
but patient should be under follow up so that we cannot she does not end up having a kidney
Kidney
loss.
failure. Okay.
You can afford to lose a ovary, but you cannot afford to lose a kidney.
Youngsters or the mid-aged women,
As I said, it impacts
everyone.
every age group. But yes, most commonly patients come to us from anywhere from 20 years to 50 years.
Mm-hmm.
But we see patients after 50 years also, we see patients in the teenage years as well.
Mm. Without pain, how will they know that they have endometriosis?
That's a good question, in fact. So, when they go for a routine health checkup or anything, if endometriosis, suppose you are detected with a cyst also,
Mm.
please go to a specialist. At least they will map the disease. That's what I'm saying. If you don't need treatment, also, at least you will be under the follow up.
Mm.
So, detection is one is examination. We
Mm.
can detect that it is not looking normal, the pelvis is not looking normal if she doesn't have symptoms. And the second is on ultrasound, we should pick it up
Okay.
because routine health checkups usually will have a ultrasound by default in the health package.
Yeah, but the thing is, without pain, without some restrictions or pain, anything like that, our Indians doesn't go to health checkups, routine health
Yeah,
checkups.
that is the importance of a health checkup.
Ha, ha,
Here
ha.
comes the importance that annual health checkup is important, and you should visit your doctor annually at least to get the checkup done.
Mhm. This is most commonly in youngsters also. They start doing it from mid-aged, but not in the
Yes.
teens or when you're getting married, at least they're not getting any checkups done. Slowly they have improved, but not
Yeah. So they
for
don't
the
understand the importance till the problem comes.
yeah,
That's
yeah.
the challenge. But still, those who have pain, at least we can start propagating that pain is not normal, and they should seek the expert help. As you asked me what age they present, they usually present around 27-30 years. I'll tell you what is the reason. They have pain from their teenage years, from school time. They used to tell their mothers and teachers, but nobody paid attention. Nobody took them to the doctor. So when they come to us from stage 1, they have already become stage 4. So that is one more reason of the delayed diagnosis, because they are not taken to the doctor in time. So if we diagnose early, definitely we can prevent the damage to the ovarian tissue, we can prevent the damage to the other organs, and we can have a good quality of life.
So, ma'am, what are the myths in this endometriosis? Common people have it.
There are a lot of myths with endometriosis. Like, it is full of myths. People think pain is normal. So first myth which everybody should understand, that pain during period is not normal. Second is, most of these patients are also told that pregnancy cures endometriosis. So pregnancy is not a cure for endometriosis. Getting pregnant is difficult with endometriosis, first of all.
Okay.
Yes, when you are pregnant, there can be a decrease in your symptoms, but sometimes pregnancy journey can be very, very painful with endometriosis. Hysterectomy is not a cure for endometriosis. People are offered that hysterectomy, let's remove the uterus, the problem will be solved.
Yeah.
So, as I said, this disease is outside the uterus. So, it is like removing a kidney for a liver disorder. So, the disease is outside the uterus, so we need to remove the disease and not the uterus. Uterus is not going to do anything until unless uterus has a disease called as adenomyosis. Now, in 42% of the cases of endometriosis, they may have associated adenomyosis. Adenomyosis is kind of a sister concern, and it is like an endometriosis of the uterus. So, if you have adenomyosis and you are symptomatic, and at an appropriate age, if you go for hysterectomy, then it's justified, but not for endometriosis alone.
At right age means at what age can they go for surgery?
There is no right timing for surgery.
Okay.
You are talking about hysterectomy, or you are talking about endometrial? So hysterectomy as such, there is no right age. We have patients of adenomyosis at a very, very young age, like 30s, in early 30s, but their life is hell. They have a almost 4-5 months size of uterus, pregnancy size. Around 24-28 week size of uterus. In those cases, hysterectomy is justified in early age group as well.
Okay.
But if they have only endometriosis, hysterectomy is not justified at all until unless they also have other issues related to the uterus. So ideally, in the perimenopausal age group, hysterectomy is justified along with the endometriosis excision, but definitely not for younger patients. So many a times patients are coming to us, their uterus is removed and they were told endometriosis will not come back, but endometriosis was not removed and her symptoms don't go away. They keep suffering in pain for years together. So these three myths are the worst myths, I would say. They are associated with endometriosis. Pain during period is normal. Pregnancy cures endometriosis. Hysterectomy cures endometriosis. These should be eliminated. These words should be eliminated from everywhere.
True.
So these are the things, these are ingrained in people's minds. It's very difficult to erase them. So we are trying our best. So I am also the founder of Endometriosis Foundation of India, where we are trying to raise a lot of awareness for people and also doctors. So we do run a training programs, as you said, how we can improve the knowledge gap for the physicians. So we are training the gynecologists, we are showing them how the surgeries are done, how you should map the disease, how to handle the complications. Also we are educating school children. Many women health organizations we are associating with to do these programs. And also we do annually a yellow ribbon run. Like, pink ribbon is for breast cancer, so yellow ribbon is for endometriosis.
Okay.
So every year in March we do yellow ribbon run. So next year it's on Women's Day, it's on 8th of March at Gachibowli Stadium. So you all should join us, and it's a great initiative where we are trying to raise awareness among the public.
Definitely, it will be from our side. We'll be helping you and the viewers also, because I've seen you sitting here in this place, many of the diseases are not even known to me also. After educating myself this much also, there are so many specialization. We don't know when we get some disease to go to the particular doctor. whom to visit. Commonly, we visit general physician. It is from there we have to be taken to the specialization. But most of them doesn't really do that.
Right. Because our referral system is not as robust as other countries. So here, physician also treats the disease, specialist also treats the disease, super specialist also treats the disease,
Whatever we
and
feel.
patients have access to super specialists directly. That is the advantage because they can reach out. But then, how many are aware of it?
That is the
That's the
thing.
challenge.
Yeah, yeah, yeah.
So our referral system, I think we need to work on that because physician should refer to the right specialist. That is what happens in some of the countries.
Mm-hmm.
But one advantage in India is that patients can reach the specialist
Yeah.
directly, which doesn't happen in other countries, and they keep suffering. Like we have patients from Canada, they have a waiting list of 2 years for a surgery.
Mm-hmm.
So we do get patients from all over the world, actually, all the
Mm-hmm.
countries, where because lack of endometriosis excision specialist is everywhere. It's a global issue.
Okay.
As I said, the lack of awareness among gynecologists, and that is also a global issue.
Okay.
So we are trying to bridge that gap, but then we need more and more doctors who come forward and treat this disease.
So is it genetically or hormonally like affected more?
As such, there is no hormonal imbalance as compared to the polycystic ovarian syndrome. People do confuse it
Yeah, yeah,
with
yeah.
that, but definitely these are two separate disorders, but they may coexist. Endometriosis patient may have polycystic ovarian syndrome, PCOS patient may have a endometriosis.
Okay.
But there is no hormonal imbalance as such, but these endometriotic implants do release their own hormones and cause inflammation and adhesions. Genetics, yes, it runs in the families, and there are certain genes which are involved in this. Still, as I said, that a lot of research is going on that, and we are yet to reach the conclusion for this.
It's not ruled out
Yeah, so
exactly.
till we have not reached that stage that where we can develop a gene therapy
Mm-hmm.
and we give it to the patient and all the endometriotic implants die away. So till we reach there, we need more and more excision surgeons and more care for these patients.
So how, like, if a girl or a woman knows that she's having pain during periods or during intercourse or something, she can directly come, or she need to get anything diagnosed, tests or something.
She should just seek a expert opinion. She may not have endometriosis, that's fine. But don't ignore a symptom which is bothering you.
Mm-hmm.
That is the point only. If they consider that they cannot do their routine activities, it is hampering their activity, definitely they should just seek a opinion. Not that every pain patient will have endometriosis. It may be something else, but then a specialist will guide you.
Mm-hmm. So, ma'am, does lifestyle changes will affect on this endometriosis?
As such, endometriosis is not a lifestyle disorder like polycystic ovarian syndrome where you can treat it with the lifestyle changes. Endometriosis, yes, incorporating good lifestyle can definitely help you manage your symptoms better.
Mm-hmm.
Like anti-inflammatory diet,
Mm-hmm.
there are some anti-inflammatory foods which we include in the diet. Definitely these patients experience less pain. The endometriosis flares are less. So they
Okay.
should switch over to an anti-inflammatory diet in consultation with a nutritionist and a dietitian.
Mm.
They can incorporate those meal changes.
Okay.
And some pelvic exercises definitely help for some of the patients.
Mm-hmm.
So they have a lot of pelvic pain. Even after surgery, sometimes they have pain. So this pelvic physiotherapy and release of these fibrotic things definitely helps in managing their symptoms in a better way. Not a lifestyle disorder, but incorporation of these things along with the other treatment modalities in consultation with your doctors definitely helps them a lot.
So, ma'am, what message do you want to give our viewers regarding this endometriosis, which will help them?
I just want to say listen to your body.
Hmm.
If you have any symptom or you have your pain, speak. If nobody is listening, speak louder and get it fixed.
So, thank you so much, ma'am. We most of them doesn't know about endometriosis. You give so much awareness to them. Thank you so much.
Thank you, Dr. Mansa, and thank you for bringing out this topic. I'm glad that we discussed about it.
Thank you, ma'am.